AVENIR Memory Care made some changes to keep their residents and staff safe, like family isn't allowed to visit right now. One thing they've kept the same is their treatment for residents, but they can't do that without the help of nurses.
We believe in kind of seeing the patient frequently.
Peggy Anger is a hospice nurse. She likes to see her patients at least twice a week.
Just for familiarity, make sure that they're comfortable in every way.
AVENIR Memory Care is one of the residential facilities where she treats patients with Alzheimer's, dementia, or any kind of cognitive impairment. Her patients here still see her twice a week, but that's not the case at all residential facilities.
Some of them have said, that we don't want you to come in maybe once every 14 days, Medicare guidelines, but we as Harmony say, we need to be able to address the patient's issues.
So does the Bureau of Healthcare Quality and Compliance. In a bulletin sent to all Nevada residential facilities, it said the Bureau has received a number of complaints of facilities denying nurses access to their patients. And it's happening on the healthcare side, too.
We had an instance where a home health company didn't want to come in here because they didn't have the proper PPE equipment.
If the nurses don't go to the residents, it means residents have to leave a familiar environment and go to a doctor's office. For people battling Alzheimer's and dementia, that's not an easy task.
The last thing we want them to do is be sitting in a waiting room for 2 or 3 hours because it can build up the anxiety.
It also takes away caregivers from the facility and increases their chances of COVID-19 exposure. Everyone who walks into AVENIR Memory Care gets their temperature taken and must wash and sanitize their hands.
If they have to run back out to their car for other supplies, we're going to do the same process over again.
Right now, family can only talk to their loved ones through Skype. Peggy told me it's why her visits are even more crucial.
They feel comforted because they can't come, and sometimes they've even peeked in a window, to see their loved one, and then the loved one is kind of confused. So we're kind of like, the eyes and ears to share with the families. It's kind of in us to step up.
I'm Kyla Gaylor, Fox 5 News, local Las Vegas.